Welcome back to Dr. Gilbert Healthy Aging. I am Dr. Gilbert. Throughout my extensive, decades-long career as a practicing clinical physician, a neurological researcher, and a general vascular and orthopedic surgeon who has operated on the shattered, fragile skeletal frames of thousands of older adults, I have spent countless hours analyzing the microscopic line that separates total, sovereign physical independence from permanent, devastating physical dependence. When you work inside emergency rooms, trauma bays, and orthopedic surgical suites across the United States, you develop a highly specialized clinical eye for the subtle, microscopic mechanics of catastrophic injuries. You begin to realize that major, life-altering accidents do not usually happen during extreme, high-risk outdoor activities. Quite the opposite. They happen inside the quiet, familiar rooms of your own home, during the most mundane, automated movements of your daily routine. And today, as a physician who has dedicated his entire professional life to senior longevity, I must look you directly in the eye and reveal a profound, terrifying, and widely ignored epidemiological fact that mainstream modern medicine completely fails to address. The single most dangerous structural movement an older adult can perform after the age of 70 is not walking up a steep flight of stairs. It is not bending down to pick up a heavy object from the floor, and it is not even stepping over the high edge of a wet bathtub. The absolute most dangerous, high-risk movement you perform inside your house every single day is the simple, seemingly harmless act of turning around to change directions. Let us sit down together and discuss a heavy, silent, and deeply unsettling physical anxiety that millions of you face in absolute, agonizing isolation behind the closed doors of your own homes. Have you noticed that when you are standing at your kitchen counter preparing a meal or washing your hands at your bathroom sink and someone suddenly calls your name from behind or your phone rings on the dining table, you experience a sudden ghostly wave of unsteadiness, a terrifying momentary sensation of internal longchuang, the exact microsecond you attempt to spin, pivot, or turn your body around? Do you find that instead of pivoting smoothly, elastically, and effortlessly on your feet like you did in your youth, you are now forced to lock your entire upper torso completely rigid, hold your breath in tight panic, and take 4, 5, or 6 tiny, tentative, awkward shuffling steps just to face the opposite wall? Do you experience a sudden, disorienting spinning sensation, a brief wave of dizziness or brain fog, whenever you turn your head quickly to look at a high shelf, or when you attempt to look beside you to check your blind spot while driving an automobile? If you answered yes to any of these common, highly concerning experiences, I want you to listen to the sound of my voice with absolute, undivided cognitive focus today. Your body is not just experiencing the normal, harmless friction of the biological clock. Your central nervous system is waving an urgent systemic red flag. You are trapped in a highly dangerous mechanical mismatch between your brain's internal gyroscopic navigation software and your lower body skeletal anchors. You are turning in a specific, modern, fear-driven way that actively triggers a complete neurological blackout, stabs your arthritic spine with destructive shear forces, and makes a devastating sideways fall mathematically inevitable over time. Allow me to share a brief, sobering clinical case study from my years in the orthopedic ward. A few months ago, a patient of mine named Arthur, a proud, retired 74-year-old high school teacher who lived a highly active, independent life, was standing in his hallway. He turned around quickly to catch his pet cat who was running past his feet. In that split second, because his feet were glued flat to the wooden floor, his knee twisted, his brain experienced a sudden gyroscopic lag, his balance compass went completely dark, and he fell violently sideways. He hit the hard oak floor with the full lateral force of his body weight. When the paramedics brought Arthur into my trauma bay, his left hip was completely shattered, a classic intertrochanteric femoral neck fracture. We had to perform emergency hip hemiarthroplasty surgery, inserting a titanium implant into his femur. But as any geriatric specialist will tell you, a hip fracture after 70 is not just a bone injury, it is a systemic event. Despite a successful surgery, Arthur lost his physical confidence, developed deep venous thrombosis in his calves from immobility, and spent months in a rehabilitation facility, permanently stripped of his ability to walk independently. His story is not unique. It is the tragic, standard path for hundreds of thousands of seniors across America every single year. Mainstream clinical medicine handles this progressive rotational instability with extreme passivity, systemic failure, and commercial laziness. When you report feeling dizzy, unsteady, or stiff when turning to your primary care doctor, they perform a brief, superficial ear exam, prescribe anti-dizziness medications like meclizine that cause severe drowsiness, or simply tell you to avoid sudden movements and hand you a prescription for a metal rolling walker. But as a physician, it is my professional duty to share the raw, unfiltered clinical truth with you today. Handing an aging adult a rolling walker without fixing their underlying neurological and physical rotation patterns is an absolute medical failure. A standard rolling walker only protects you when you are moving forward on a flat, straight line. The exact microsecond you attempt to pivot or turn around with a walker, the mechanical frame itself becomes a pivot trap, shifting your center of mass outside your base of support and actively pulling your body weight down into a severe lateral hip fracture. I did not create this comprehensive, ultra-deep dive masterclass to leave you sitting in a state of helpless fear, psychological discouragement, or permanent dependence on assistive devices. Fear is a paralyzing, toxic emotion that serves absolutely no therapeutic purpose in your longevity journey. Quite the opposite. Today, I am going to hand you an absolute, scientifically validated, and highly concentrated mechanical shield of protection. In this episode, I am going to reveal one remarkably simple, highly effective daily exercise specifically engineered to retrain your body's turning reflexes, permanently erase rotational dizziness, and insulate your balance after the age of 70. This specialized neurobiomechanical movement requires absolutely zero gym memberships, zero specialized exercise equipment, and absolutely no athletic strength. It takes less than 3 minutes of your time each day, and it can be performed while holding onto a solid wall or a sturdy kitchen counter for absolute, total physical safety. Yet, despite its profound simplicity, this single movement possesses the unique physiological power to completely recalibrate your inner ear gyroscope, awaken your sleeping ankle proprioceptors, decompress your cervical and lumbar spine, and permanently restore the fluid, elastic, and unassisted freedom of movement that you deserve. If you are truly ready to stop shuffling in fear, permanently dissolve that terrifying sensation of dizziness when turning, and reclaim your absolute physical sovereignty, turn off all background noise and distractions right now. Focus your mind, adjust your shoes, and let us break down this deep anatomical knowledge together. This will be the most critical hour you spend on your health and longevity this year. Before we unlock the elegant neurological engineering behind your body's gyroscopic balance networks, take a brief moment to click that subscribe button and turn on the notification bell. By doing so, you join our global healthy aging family and ensure you are always equipped with the real clinical truths needed to protect your independent freedom for decades to come. Now, let us uncover the hidden mechanical and sensory collapse that occurs inside your body whenever you attempt to turn around after 70. To permanently eliminate the threat of falls during rotation, a clinical engineer must diagnose the precise mechanical and sensory failures that occur inside the senior body during a turn. Moving forward on a straight line is relatively simple for your brain to compute. It requires a linear progression of weight transfer. But executing a turn, spinning your body 180 degrees to face the opposite direction, is a highly complex, multidimensional computational feat managed entirely by your central nervous system. It requires the high-speed, flawless synchronization of three major internal systems: your inner ear vestibular gyroscope, your neck cervical mechanoreceptors, and your ankle-foot strategy. Unfortunately, after adults pass the biological milestone of age 70, this sophisticated rotational software undergoes a complete, silent collapse. In my senior longevity clinic, I look at the diagnostic data and discover that this collapse is driven by three distinct, hidden pathologies. First, we must analyze the vestibulo-ocular reflex, VOR mismatch. Deep inside your temporal bones in the inner ear lies your vestibular system, the fluid-filled gyroscope containing three orthogonal semicircular canals. Every single time you turn your head, the fluid inside these canals moves, stimulating microscopic hair cells to instantly report the speed and angle of rotation to your brainstem. In a healthy young body, this gyroscope controls a brilliant reflex called the vestibulo-ocular reflex, or VOR. The VOR ensures that when your head turns to the right, your eyes instantly move to the left at the exact same speed, allowing your gaze to remain completely locked onto a stable target. However, after age 70, the inner ear fluid becomes thicker, stickier, and slower to move, and the sensory hair cells experience significant natural cell death. When you turn your head quickly to look behind you, your inner ear gyroscope experiences a massive processing delay. It fails to report the movement to your brain in real time. Your eyes slip off their visual target, causing your brain's visual map to blur violently. This processing lag triggers a sudden wave of severe rotational dizziness and disorientation, causing your brain to lose its orientation in three-dimensional space. Second, we must examine the frozen ankle strategy and the block turn trap. When you were young and your joints were highly elastic, initiating a turn was an elegant bottom-up chain reaction. You simply spun the ball of your leading foot, your ankle joint flexed, your knee rotated slightly, your hips pivoted, and your upper body followed smoothly. But over decades of life, due to chronic lack of dynamic movement, your ankle joint capsules experience severe calcification, and the deep mechanoreceptors beneath your soles fall into a state of total dormancy. Your ankles become completely rigid, frozen, and locked like wood. Because your ankles cannot pivot, you are forced to execute what we call in neurology a block turn. You lock your ankles, your knees, your hips, and your neck into one single, stiff, rigid metal-like block, and you spin your entire body all at once by taking multiple, rapid, awkward shuffling steps. Look at the mechanical catastrophe of the block turn. Because your entire body moves as one stiff mass, your center of mass is easily thrown outward by centrifugal force. If your foot catches on the floor during this clumsy turn, you cannot execute a corrective step, and you fall violently sideways. Third, we must address the lumbar shear stress failure. Because your ankles are frozen and you are attempting to turn around, your body tries to find rotation somewhere else. It attempts to force the rotation to occur inside the joints of your lower back, the lumbar spine. But human anatomy was engineered with strict limitations. The lumbar vertebrae were designed exclusively for flexion and extension, bending forward and backward. They possess almost zero capacity for rotation. Each lumbar vertebra can only rotate by a tiny $1 circ to $2 circ. When you force a rigid, arthritic lower back to twist and wring violently to complete a turn because your feet are glued to the carpet, you place immense, destructive shear forces directly onto your delicate intervertebral discs. This chronic shearing action accelerates disc herniation, pinches the exiting sciatic nerve roots, and forces your deep spinal muscles to lock up into excruciating, chronic spasms that completely paralyze your mobility. Can you see the absolute mathematical danger you face every single day just by turning around to face your kitchen counter? A delayed inner ear gyroscope, frozen ankles, a blind brain, and a sheared lower back combine to turn a simple turn into a deadly fall trap. Sideways falls are the absolute direct explanation for why over 90% of hip fractures in the elderly occur during simple in-home pivoting movements. To break this lethal cycle of decay, we must implement a specialized daily movement that recalibrates your inner ear leveler, thaws out your frozen ankles, and protects your spine from destruction. Let us now move away from the theoretical anatomy of structural decay and focus 100% of our clinical energy on the solution. I am going to teach you how to execute the single most powerful, medically engineered rotation exercise designed to permanently eliminate dizziness, unlock frozen ankles, and protect your body from falls after the age of 70. This specialized neurobiomechanical movement is known in advanced sports science and geriatrics as the seated and standing step pivot matrix. When older adults feel unsteady or experience dizziness when turning around, their natural, fear-driven instinct is to avoid turning completely. They tell themselves, "I will just turn extremely slowly," or "I will avoid looking behind me entirely." But in the practice of neurology, we possess an unyielding law. What you avoid, you permanently lose. If you minimize or stop challenging your inner ear gyroscope and your ankle strategy during rotation, those neural pathways will undergo rapid, irreversible wasting and degradation. Your balance compass will shrink until you can no longer even stand up without spinning out of control. We must do the exact opposite. We must safely, systematically expose your nervous system to a highly controlled, beautifully engineered rotational challenge to force your brain to rewrite its balance software. This specialized step pivot matrix is incredibly brilliant because it is designed with a strict, bottom-up integration philosophy. It completely breaks the dangerous block-turn trap by forcing your feet and ankles to unlock before your upper body and head ever begin to rotate, completely eliminating shear stress on your lower back and preventing visual blurring. Let us perform this therapeutic masterclass together right now. Stand up from your chair. Find a clear, flat space on your floor directly next to a solid wall or a heavy kitchen counter for absolute, total physical safety, and follow me through the 3 precise phases of this neurological reset. Phase 1, the rotational anchor pivot, the toe unlock. The first phase is engineered to completely thaw out the calcified stiffness inside your ankle joints, awaken the dormant proprioceptors beneath your soles, and establish a solid mechanical foundation for the turn. To perform this perfectly, stand completely tall, facing a flat wall or directly next to your kitchen counter. Place your inside hand flat against the surface at chest height for a continuous, unyielding safety anchor. Place both of your feet completely flat on the floor, spaced exactly shoulder width apart. Keep your spine long, pull your shoulder blades gently back, and lock your eyes onto your visual anchor straight ahead on the horizon line. Inhale deeply through your nose for 3 slow seconds, expanding your lower abdomen with air. We are going to practice a turn to the right. As you begin to slowly, smoothly exhale through your mouth, shift 90% of your total body weight onto your left foot, allowing your left knee joint to bend slightly by just 1 centimeter to act as a compliant shock absorber. Now, lift the heel of your right foot slightly off the floor so that only the ball of your right foot and your right big toe are making contact with the ground. Consciously drive your right big toe down into the floor and actively spin your right heel inward toward your left foot, causing your right foot to point outward at a 45-degree angle. Feel the deep rotation occurring exclusively inside your right ankle joint and hip socket. Hold this open anchor position for 2 full seconds. Your chest and head must remain completely straight, facing forward. Do not turn your upper body yet. Phase 2. The compliant target advance, the step transfer. The second phase is designed to safely execute the transfer of your body's center of gravity onto the newly aligned foot, completely boxing out lower back shear stress. From your open ankle anchor position achieved in phase 1, lift your left foot completely off the floor. Take a short, compact step forward and outward with your left leg, landing your left foot completely flat, soft, and whisper quiet next to your right foot, facing the new 45-degree direction. Ensure the entire sole of your left foot touches the ground at the exact same microsecond, with a soft, slightly flexed knee. There must be absolutely no audible slamming or thudding sound against the floor. Shift your body's entire center of mass directly over the midpoint of your flat left foot. Slide your safety hand smoothly along the wall or counter to maintain your absolute mechanical balance anchor. Hold this landing position for 2 full seconds. Feel the solid, anchored strength of your thigh holding your weight in the new direction. Your torso remains stacked vertically over your hips. Phase 3. The visual tracking synchronization. The gyroscopic reset. The final phase is engineered to retrain your lost vestibulo-ocular reflex, VOR, forcing your inner ear fluid and your eyes to communicate at high speed to permanently wipe out dizziness. Now that your feet and hips have safely established a solid base of support in the new 45-degree direction, you are ready to bring your head and eyes around. Do not spin your head rapidly or blindly. Choose a specific visual target on the wall opposite you in the new direction, such as a picture frame, a light switch, or a mark on the wall. Consciously turn your head smoothly, keeping your eyes completely laser-focused locked onto that visual target. As your head completes the rotation, execute a deep blink with both eyes and then expand your visual awareness to take in the vertical lines of the room. Hold this final position for 2 full seconds, breathing smoothly. Feel how your brain instantly processes the stable, unblurred environment because you allowed your base of support to turn before your head moved. Repeat this exact 3-phase matrix continuously, step by step, until you have completed a full 180-degree pivot, and then reverse the direction to return to the start. I want you to perform 10 complete controlled turns daily. Perform 5 full turns pivoting to the right, and then immediately switch your safety anchor and perform 5 full turns pivoting to the left. Why is this specific step-by-step matrix so profoundly effective? When you execute phase 1 by spinning your right heel inward while keeping your chest forward, you are manually forcing your frozen ankle joint capsule to flex and rotate under a light, safe mechanical load. This action forcefully dissolves stiff tissue friction and blasts your spinal cord with high-definition proprioceptive data from your soles. When you execute the compact step transfer in phase 2, you are ensuring that your body weight is always supported by a wide, flat base of support. Your spine remains perfectly neutral and vertical, meaning the destructive shear forces never reach your lumbar discs. You are completely protecting your lower back from injury. Finally, in phase 3, by locking your eyes onto a fixed target and turning your head smoothly after your feet are anchored, you are providing your delayed inner ear gyroscope with a clean, controlled computational challenge. You are training the vestibulo-ocular reflex to track targets without slipping. The fluid inside your ear canals balances out. The corrupted static electricity in your brainstem vanishes, and the terrifying sensation of dizziness completely dissolves. You have built an absolute shield of balance safety. Now that you thoroughly understand the deep mechanical and sensory physics behind the step pivot matrix, we must establish the precise clinical dosage, scheduling protocols, and the biological timelines of how your nervous system and joint tissues will adapt and recover. In the practice of senior longevity, a physical movement operates exactly like a prescription pharmaceutical compound. If you take the incorrect dose, or if you practice it at random times, your brain will fail to construct permanent neural pathways. To achieve a complete restoration of your turning reflexes and insulate your body against sideways falls, I want you to perform this simple routine once every single day, without exception. I highly recommend performing your daily step pivot matrix practice in the late afternoon, around 3 p.m. or 4 p.m. This is the absolute best biological window for gyroscopic and inner ear retraining. During the early morning hours, your vestibular fluid is highly dense, viscous, and sluggish, and your arterial blood pressure undergoes violent morning surges, making you highly prone to positional dizziness. By late afternoon, your systemic blood pressure has stabilized, your core body temperature peaks, and your neurological reaction velocity is at its absolute maximum, allowing your cerebellum to process sensory data with maximum efficiency and zero cellular strain. It takes less than 3 minutes of your time. However, if you feel highly unstable when performing daily chores, I want you to employ a progressive behavioral habit that I teach to all my clinical patients. The sink side protocol. Every single time you stand at your kitchen sink washing dishes, or stand at your bathroom counter brushing your teeth, Do not just stand there in static stagnation. The moment you finish your task, place one hand firmly on the edge of the heavy porcelain sink or counter for a total safety anchor, and execute 3 controlled step pivot matrix repetitions on each leg before you walk away. By transforming these automated daily chores into highly effective balanced physical therapy sessions, you will complete over 40 rounds of neurovascular training every single week without ever having to set aside a separate workout time. What should you expect to experience inside your body when you begin practicing this routine consistently? During the first 7 days of the gyroscopic calibration, you will likely feel a strong sensation of intense concentration and minor temporary lightheadedness during phase 3 of the turn. Do not be discouraged by this. It is a phenomenal clinical indication that your brainstem is actively working to recalibrate your delayed inner ear gyroscope and recruit dormant motor pathways. By day 5, that sudden wave of spinning dizziness when you turn your head will drop by nearly 50%. By the end of the first 30 days of the ankle strategy resurgence, the calcified stiffness inside your ankle joint capsules will dissolve dramatically. Your mechanical clearance will increase, and the mechanoreceptors beneath your soles will be fully awake. You will notice that you no longer need to execute the clumsy, rigid block turn. Your feet will naturally and smoothly step and pivot the moment you change directions. After 90 continuous days of total postural balance insulation, your central nervous system permanently overwrites the old, dangerous shuffling gait software. Your deep hip stabilizers, your gluteus medius, will become dense, responsive shock absorbers, and your lumbar spine will be completely insulated from destructive shear stress. You will move through your environment with absolute, uncompromised stability and physical freedom. You have successfully reclaimed your physical sovereignty. As a physician and a general surgeon who looks at senior longevity through a comprehensive holistic lens, I must remind you that practicing your daily step pivot matrix is only half the battle. You cannot expect to permanently insulate your balance if you are unknowingly committing these 3 common, deadly lifestyle mistakes inside your own home. These everyday errors actively scramble your inner ear sensory data, damage your spine, and completely undo all the neurological healing we are building. The first error is the blind pivot, turning head first. When a senior needs to turn around quickly, such as when a loud noise occurs behind them or a pet jumps near their legs, they almost universally make the fatal mistake of whipping their head and eyes around before moving their feet. From a neurological standpoint, this is an absolute disaster. When you whip your head around while your feet are glued flat to the floor, your delayed inner ear gyroscope experiences a massive, high-velocity acceleration lag. Your visual field blurs violently, your brainstem drops offline in panic, and your lower back vertebrae are subjected to immediate, extreme shear forces. Your knees buckle in confusion, and you crash violently sideways before your legs even take a step. You must employ the strict rule of feet first, head last. The exact microsecond you need to turn, unlock your ankle, and step your foot out before you allow your eyes and head to rotate into the new direction. The second error is the one-foot pivot, the twist and slip. Many seniors attempt to turn around by keeping all their body weight pressed onto one single leg and simply twisting their knee and hip sockets aggressively over that planted foot without lifting the foot off the ground. This creates a highly hazardous mechanical environment. When you twist all your body weight over a planted, unlifted foot on a high-friction surface like carpet or rubber-soled shoes, you place extreme, destructive rotational stress directly onto the thin ligaments of your kneecap and hip. This triggers immediate joint pain, forces your muscles to lock up in protective weakness, and if the foot slips slightly, your center of mass drops instantly past your safety threshold, triggering an immediate fall. Never twist on a heavily planted foot. Always lift your unweighted leg completely off the floor and take a short, distinct, compact step transfer to execute the turn safely. The third error is living in a state of visual dependency, staring at the floor. Because seniors feel unsteady when turning, they become completely dependent on their eyes for balance data. They drop their chin down and stare intensely at the floor just 12 inches ahead of their big toes while turning around. But staring at the floor completely uncalibrates your inner ear gyroscope, erases the stable vertical and horizontal lines of the room from your brain's navigation computer, and forces your shoulders to slump heavily forward. When you attempt to turn while staring down, your brain cannot calculate lateral movement, making you highly prone to losing your balance sideways. Keep your chin up, parallel to the earth, and look straight ahead at the opposite walls during your turns, forcing your brain to use its natural gyroscopic software. To accelerate your neurological recovery, completely wipe out chronic morning dizziness, and restore the youthful high-speed tracking capacity of your central nervous system, I want to share 3 bonus daily habits that complement your step pivot matrix perfectly. These are the exact therapeutic strategies I prescribe to patients inside my senior longevity clinic to systematically reverse vestibular degradation and protect their mobility. 1. The Gaze Stabilization Protocol, VOR Retraining. Every single afternoon, before you practice your step pivot matrix, sit completely tall in a firm, supportive chair. Hold your right thumb straight out in front of your face at eye level. Lock your eyes completely onto your thumbnail. Now, keep your eyes laser-focused, locked onto that single target, and slowly, smoothly shake your head side to side from left to right, as if you are saying no. Do this for 30 slow seconds. Then, repeat the exact same movement, shaking your head up and down, as if you are saying yes, for 30 seconds. This simple neurological exercise forcefully trains your vestibulo-ocular reflex, teaching your eyes and your inner ear gyroscope to communicate at lightning speed, completely eliminating motion dizziness. 2. The cervical muscle release, suboccipital decompression. The tiny muscles at the very top of your neck, directly beneath the base of your skull, the suboccipital muscles, are packed with the highest density of balance mechanoreceptors in the entire human body. When these muscles become tight and rigid due to a forward head posture or looking down, they physically compress the vertebral arteries and send corrupted spatial data to your brain, causing severe unsteadiness during head rotation. Every evening, spend 2 minutes using your fingers to gently massage the soft tissue directly beneath the hard ridge at the back of your skull, breathing deeply, to decompress your neck and clear your internal signaling pathways. 3. The sensory soul activation. Before you retire to bed, spend 2 minutes rolling a clean, hard tennis ball or a specialized wooden foot massage roller back and forth beneath the soles of your bare feet, with light, comfortable pressure while seated. This mechanical friction acts like a high-voltage wake-up call for your sleeping proprioceptors, forcefully breaking through the dead, cardboard-like sensation beneath your soles and flooding your brain's cerebellum with vivid, high-definition spatial data, preparing your feet to anchor your weight safely tomorrow morning. My dear friends, as we draw this comprehensive vestibular and mechanical rotation masterclass to a close today, I want to step away from the clinical statistics, step away from the anatomical charts, and speak directly to your heart, not just as a physician, but as a trusted companion on your journey of aging. Reaching your 70s, 80s, or 90s is an extraordinary, sacred milestone. It is a triumphant, beautiful season of life that should be completely defined by your personal freedom, your profound acquired wisdom, your peace, and your joy, not by physical restriction, daily isolation, chronic joint pain, and a constant, creeping fear of your own kitchen floor. You have spent your entire life working hard, sacrificing for your families, and building the very architectural foundations of our communities. You have earned the absolute sovereign right to live this golden season of your existence, with uncompromised physical dignity, with your chin held proud toward the horizon, and with the complete physical freedom to move through this world entirely on your own terms. Losing your stability, experiencing that terrifying sensation of dizziness whenever you turn around, or being forced to take multiple, rigid, shuffling steps just to face a different direction is not an organic, inevitable consequence of growing old. It is simply a biological puzzle, a puzzle of sleeping nerve receptors, uncalibrated inner ear gyroscope fluid, and dormant brainstem survival reflexes. And as we have demonstrated together today, using the profound science of neuroplasticity, every single piece of this puzzle has a logical, scientific, and remarkably beautiful mechanical solution. Do not allow the passive, assembly line attitudes of modern medicine to dictate the boundaries of your personal world. Do not accept a life that slowly shrinks into a single room, a single safe chair, or a rolling metal walker. Your body remains an absolute miracle of biological engineering, fully capable of neuroplastic adaptation, capillary expansion, and nerve recovery until the final breath you draw on this earth. You do not lack the inherent capacity to heal, you simply lack the correct clinical blueprint. Now, today, you possess that blueprint. I challenge you right now as your physician, the moment this video finishes and the screen goes quiet, do not just sit there in stagnation. Stand up from your seat, place one hand lightly on a sturdy wall, lift your chin up to track the horizon, unlock your ankle, and execute your very first step pivot matrix repetition. Hit the reset switch on your nervous system. Send the immediate, powerful signal to your body that you are ready to stay strong, ready to protect your joint cartilage, and ready to reclaim your physical sovereignty. Thank you from the bottom of my heart for your time, your trust, and for opening your heart to me today. Subscribe to our channel, move with deep intention every single day, honor your magnificent physical temple, execute your daily step pivots, and I will see you in our very next clinical episode. Stay strong, look straight ahead at the horizon, and step forward into your day with absolute, magnificent power.